Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Have you ever heard about infectious mononucleosis? It's a viral infection that's often referred to as mono or the kissing disease. This intriguing name originates from one of the common ways the disease is spread, through saliva. Yes, a simple act of sharing a drink or a kiss can transmit this virus. Infectious mononucleosis is primarily caused by the Epstein-Barr virus, a common and highly contagious pathogen. Most people get infected with it at some point in their lives, often during childhood. The curious thing about this virus is that it can remain dormant in your body, but under certain circumstances, it can reactivate and cause mono. Typically, infectious mononucleosis affects teenagers and young adults. However, it can occur at any age. The disease is characterized by a high fever, sore throat, swollen lymph glands, and fatigue. So, now that we know what it is, what are the signs and symptoms of this so-called kissing disease? Infectious mononucleosis can present a variety of symptoms, some of which can be quite severe. The most common sign of this disease is overwhelming fatigue. You might feel so tired that even small tasks seem like monumental challenges. Along with fatigue, a sore throat is another common symptom. It's not just any sore throat, but one that's so severe it can be mistaken for strep throat. Fever often accompanies this sore throat, a body's natural response to infection. Swollen lymph nodes, particularly in the neck and armpits, are also typical of mono. You see, these tiny glands are part of your body's immune system, and they swell in response to infection. Similarly, your spleen, an organ in your upper left abdomen that helps filter your blood, may also swell. These symptoms can last for weeks or even months, making mono a long-term companion for some. With such an array of symptoms, how do doctors diagnose mono? Diagnosing infectious mononucleosis involves a few steps, primarily because its symptoms can be similar to other illnesses. The process starts with a thorough medical history, where the doctor will ask about recent symptoms, exposure to someone with mono, or travel to areas where certain mosquito-borne diseases are common. Next comes a physical examination. The doctor will look for signs like swollen lymph nodes, tonsils, liver or spleen, which are common in mono. But the real key in diagnosing mono lies in the blood tests. The monospot test checks for antibodies that your body might produce in response to the Epstein-Barr virus, the most common cause of mono. Another test is the Epstein-Barr virus antibody test. This test can determine if you've recently had the virus or if you were infected in the past. These tests together help doctors confirm a diagnosis of mono. Once a diagnosis is confirmed, what's the next step? How do we treat mono? There's no specific cure for mono, but treatments can help relieve symptoms and improve recovery time. As surprising as it may sound, sometimes the best medicine can be as simple as giving your body what it needs to recover on its own. Rest is a key element in treating mono because it allows your body to focus its energy on fighting the virus. So don't be shy about catching those extra Z's. Your body will thank you for it. Hydration is another critical aspect of treatment. Drinking plenty of fluids helps to flush out the virus from your system and also prevents dehydration, a common complication associated with fever. So, keep a water bottle handy and remember to sip throughout the day. Over-the-counter medications can also be beneficial for managing symptoms. Non-prescription drugs like acetaminophen or ibuprofen can help reduce fever and relieve throat pain, making it easier for you to rest and recover. However, it's important to avoid giving aspirin to children or teenagers with mono, as it can lead to a rare but serious condition known as Reyes syndrome. Now, let's talk about prevention. One important precaution to take when dealing with mono is to avoid contact sports or heavy lifting. This is because mono can cause the spleen to enlarge and become vulnerable to rupture, a serious complication that can require immediate medical attention. Preventing mono from spreading in the first place, though, is a bit trickier. Since the virus is commonly spread through saliva, it's important to avoid sharing drinks or personal items like toothbrushes and to practice good hygiene. This means washing your hands regularly, not touching your face unnecessarily, and covering your mouth when you cough or sneeze. It's worth noting that while these measures can reduce the risk of contracting mono, they aren't foolproof. The virus can live outside the body for hours and can still be contagious, even when symptoms aren't present. While there's no certain way to prevent mono, being aware and taking precautions can significantly reduce your risk. So stay vigilant, take care of your health, and remember, prevention is always better than cure. Infectious mononucleosis, though common, is often misunderstood. We've navigated the realm of this viral ailment, exploring its signs and symptoms, from fever and sore throat to fatigue. We've discussed its diagnosis, emphasizing the importance of medical consultation and testing. We've also touched on treatment, underscoring rest, hydration, and symptom management. Importantly, we've highlighted prevention strategies like avoiding shared personal items. Remember, knowledge is power, especially when it comes to your health. Stay informed, stay safe. UMCC, your ultimate medical consultant connector.